Information on this show is provided for informational purposes only and is not meant to replace the advice of your own physician or other medical professionals. It should not be used for diagnosing or treating a health problem or disease. If you suspect you have a medical problem, promptly seek help from a healthcare provider. Advice is free. Toothbrush and toothpaste not included.
If you have an infection going on inside your mouth for years that is symptom-free, and you're dumping pus into your bloodstream for not just weeks or months, but literally for decades, do you think that can have some effect on your overall health? Man, absolutely.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Okay, well, welcome to Your Filthy Mouth podcast, episode number 4. We're on the core 4, the fourth of the core 4, Dr. Chuck. We're glad that you're here. And I always like to recap what the whole purpose is of your motivation and your mission of getting the word out about this.
Well, first of all, thanks. This has been a great experience. We're trying to get the word out.
Yeah.
And the mission is to try and help people connect the dots between what's going on in your mouth and what's going on in the rest of your body. So if you have an infection in your mouth, it doesn't stay in your mouth. It goes to the rest of your body. And it affects so many other things like heart attacks and strokes and diabetes and pregnancy complications. And there's so much that we can prevent or at least decrease the risk factor that we just want to get the word out. So help people understand it and ask questions. Don't be afraid to ask your dentist or your physician questions.
So someone who's just listening for the first time, they go, yeah, you're just trying to get extra money. This whole scare me, I'm going to have a heart attack or a stroke. Explain the physical way that can happen.
It's actually just the opposite. We're not trying to get more money. We're trying to get less money by helping you keep a healthy mouth. So what happens when you have a gum disease going on, or you have a cavity with an abscess on the tooth, there's bacteria with that. That's an infection. That infection gets into your bloodstream. I don't care if the infection is in your foot, your hand, or your mouth. All of them do the same thing. The bacteria gets into your bloodstream. Pus. What is pus? Pus is bad bacteria, harmful bacteria, dead tissue debris, dead white blood cells, inflammatory proteins, and some other toxins. Well, this pus is absorbed into your bloodstream. Again, there's no pain with the gum disease you have going on, and many times, most times, even with the dental abscess, there's no pain. But you're dumping the pus into the bloodstream. From there, it goes to the heart, then it's pumped to the lungs, back to the heart, and it's pumped to the whole body. So whatever happens in the mouth goes through the whole body. I mean, whatever happens in Vegas may stay in Vegas.
Not in the mouth.
Not from the mouth. No, it goes everywhere. And when you have this symptom-free infection going on inside of your mouth, not just for weeks or months, but literally for decades, you've been dumping pus into your bloodstream for a long time. The research has already been done to show that the bacteria in periodontal disease are causative for cardiovascular disease. That is a huge statement. It was done in the British Medical Journal in November of 2016. There's a great article in there, shows how they've done this. And this is a peer-reviewed, so you can't get it in there without a whole lot of people agreeing that, yeah, this is true.
It seems like the mouth would be just the absolute perfect atmosphere for germs to harbor, the moisture and, the easy access to germs right away.
Oh, absolutely. Absolutely. It's warm, it's wet, you got you got food in between your teeth that they can live on.
Wow.
I mean, you got all kinds of good reasons why they want to multiply inside your mouth.
All right. Well, we're going to bust some myths today. Who are you going to call? Not MythBusters. We're going to call Dr. Chuck today. Okay. Myth number 1. My mouth doesn't hurt, so it must be healthy.
Well, lack of pain does not equal health. Like we talked about, high blood pressure, diabetes, glaucoma, cancer. Lack of pain does not equal health. You can have this going on for a long time. That is a challenge with even the medical profession. One of my patients is a physician, and he had lack of pain. But he called me one time and he said, "Hey, Chuck, my teeth are starting to get loose." I said, "Well, make an appointment. Let's get you in." So he made an appointment, and by the time he made an appointment and came in, one of his lower teeth fell out.
Oh, my goodness.
Severe periodontal disease, lack of pain, no pain. He thought as long as it didn't hurt, he was fine. Well, he was also diabetic, and so he was having a challenge controlling his medication for that. So once we educated him about gum disease and what was happening with that, his mouth is so much better. He ended up losing 6 teeth.
Wow.
And we're replacing those. But now he sees, oh my gosh, this really, just because it doesn't hurt doesn't mean it's okay. I can tell you story after story of people that have come in with no pain, but as soon as you show them what's going on, it's like, oh, why doesn't that hurt? And I'm like, yeah, wouldn't it be great if that hurt?
Mhm.
The older I get, the more I like pain. Now, let me explain that.
Yes, please.
I never ever want to create pain. We will do everything we can not to create pain, but I have never seen a bigger motivator than
Mm.
pain. You'll tell someone you got a cavity on this tooth. Yeah, yeah. Well, we need to get a filling in there. It doesn't hurt. We'll get it later. You know,
Yeah.
and by the time it hurts, now you've taken a tooth that needed just a filling to where many times now it needs a root canal, possibly a much bigger filling, a crown, a post, all these other things that could have been completely avoided had you done it before it hurt.
Mhm.
So waiting for pain is very expensive.
Okay, so myth number 2, when you get older, you're just going to lose some teeth. I mean, it's just you lose hair,
Yeah,
you lose
people
teeth.
people used to think, your hair's gonna get bad, your eyes are gonna get bad,
I'm
your
gonna
teeth
gain
are gonna get
weight,
bad,
right,
yeah,
uh-huh.
all this,
Mhm.
and let me just say, I have in our practice we have a little over 250 patients that are 90 years old or older. Most
No. Are
absolutely.
you serious?
We're in Central Florida.
Oh, yeah, that's
We're
true.
in Central Florida.
Good
Yeah,
point.
yeah. And uh, people move to Florida to live, by the way, not to die. They move here to live. You
Right.
don't shovel sunshine.
Oh,
So,
man, I
yeah.
love that. That should be a bumper sticker.
Yeah, yeah. So it's a good place to be, but most of these people have the vast majority of their teeth, and sometimes the reasons they lost their teeth younger was they could have been saved today. But no, you don't have to. If you do the preventive things that we're talking about, and that's the key right there. You don't want to come in when the horses have left the barn.
Mhm.
I mean, we're trying to keep the horses in the barn so we don't have that problem. So, but no, you don't have to lose any teeth. Now, sometimes you got crowding because of orthodontic issues going on. It's difficult to keep them clean. You get gum disease, and you're going to end up losing some teeth. But if you deal with it early enough in your life and you're educated about what you have to do at home, you don't have to lose teeth, which is going to save you a lot of time, money, and avoid pain.
I like all 3 of those
Yeah.
to be avoided. Yeah. Okay. Another myth that oral infections they just stay in your mouth.
When I was in dental school, there was a bunch of us students, and I had a real good class. And we questioned, when you have an infection in the mouth, why doesn't it get in the rest of the body? Well, we were taught, oh, there's some type of an oral barrier that keeps it from getting into the body. And later on, I learned, yeah, there's a placental barrier that keeps getting from into the developing baby, or there's a blood-brain barrier to keep the bad things out from into the brain. Well, if bacteria penetrate a barrier, there's not much of a barrier. In fact, there is no barrier.
Right.
So whatever happens in the mouth, once it gets into the bloodstream, boom, it goes everywhere.
Mhm.
When they give you they're knocking you out for surgery, and they say count backwards from 100. How long does that take? 2-3 seconds?
Yeah, it gets a
before?
99.
Yeah, yeah. Whenever they started injecting, how long did it take to go
Wow.
from your arm to your brain? It's a matter of seconds.
And that's
how-
happening in your mouth.
That's happening. Absolutely. That's how
Wow.
quickly it's distributed.
We need to think differently about this.
Yep.
To make that analogy makes perfect sense.
Yep.
How fast it can travel.
Yeah. Yeah.
All right, that myth is busted. So another myth. My parents had bad teeth, so I'm going to have bad teeth. It's inherited. I'm predisposed to it.
There can be a genetic predisposition to having dental issues, but that doesn't mean you're doomed. They've shown that if you'll take care of the bacteria in your mouth, certain genes will not be turned on. I know it's crazy. The way the research is going now is that you can have the susceptibility, but it doesn't mean you're doomed. If you'll take that extra time every day, you're not going to get gum disease. You're not, because it takes bacteria to get this. It doesn't happen genetically. It happens because of bacteria. Another interesting fact is that after, golly, almost 40 years of practice now, I've never seen a patient that had severe gum disease and severe cavities. It's been one or the others. Some people are genetically predisposed to gum disease. Some people are genetically predisposed to cavities.
Huh.
Okay. So, but if you keep them really clean, you don't go either way. But I've never had a patient that had really severe gum disease and a lot of cavities.
So would you compare kind of being predisposed because your parents had it kind of like being heavy? Well, both my parents are 50 pounds overweight. I'm just going to, but if you go to the gym and you're cognizant and you eat healthy, it doesn't have to be that way. You're breaking the generational curse.
Well, you
Mm.
hit the nail on the head. So many of the times we call predisposed, and really what it is just lifetime habits.
Mm.
So this is lifestyle habits that we've developed. Well, it could be home care, it could be the way you take care of your teeth, it could be the diet, it could be what you eat all day long. But these are lifestyle choices. These are not genetic dispositions.
Right, right. Yeah.
But these are lifestyle choices. So if you take somebody with mom and dad, and each one of them are 400 or 500 pounds, does the child have to be that way? No, they
Right.
can make a choice not to.
Mm.
One of the courses I went to is on the oral systemic, and the instructor happened to have his mother there.
Mm.
I won't tell you how old she is
Okay.
just yet, okay?
Okay.
But her sisters and her mother all died in their 60s
Mm.
with cardiovascular disease, diabetes, all kinds of issues. They were from North Carolina. They used to eat, family style.
Oh,
man.
that good barbecue.
Yeah, they did all that.
Mhm.
One of them was called Candy Grandma because she always had candy in her apron pocket for whoever wanted it,
Aw.
and she was the number one person for it.
Mhm.
But this one particular lady saw what was happening, and she did not want to do that. So she completely changed her lifestyle and her diet when she was in her 20s. And she started eating healthy. She started exercising. She took up golf. She actually got pretty good at it.
Mm.
But while her sisters and her mother all died in her 60s, she still plays golf. She looks fantastic. She's 93,
Wow.
and you wouldn't believe it to look at her. And she's just as
Wow.
healthy as can be, enjoying life. But her son is a dentist.
Mhm.
Okay, so yes, she does have a healthy mouth. Yes, she does take care of it at home. He
Mhm.
doesn't brush her teeth every day, clean her mouth.
Mm.
But there's a great example how you don't have to, you're not doomed. Just because your mom and dad had particular genes, you're not doomed. You can't override that with proper home, home care.
So as we're talking about blaming our parents and heredity, one of the myths that I've heard is, well, my teeth are bad because my mom didn't give me whole milk.
There's a lot of
I wasn't breastfed.
there's always going to be excuses.
Right.
Sometimes we make decisions emotionally, and then we're looking for something to back that up,
Or someone to blame.
or someone
Yeah,
to blame.
yeah.
It can't be me.
Right.
But the as one of my things is that people sometimes are more interested in health insurance than they are health, because with health insurance, somebody else has to take care of me.
Mm.
With health, I have to take some responsibility,
Mm.
and that's one of the things we want people to get interested in, is more health than health insurance.
Mm.
So anyway,
Yeah.
I got off the
Yeah,
sidetrack
no,
on
that's
that.
okay.
But that
So
we can
about
put that in
the
somewhere.
not having the milk or being breastfed, that's why I have bad teeth.
Yeah, they used to think that when a woman was pregnant, the calcium was sucked out of her teeth. That's
Mhm.
why her teeth went
Yeah.
bad, and that was all for the baby.
I remember that. Yeah.
Yeah, well, that's not true.
Okay.
When a tooth forms, that's it. Now, your bone is different. Calcium is continually being deposited into your bone and taken up within your bone. So that's continually going on, but not the tooth. Once that tooth forms, that's it. So it didn't come. What happens, though, is when a woman is pregnant, many times she goes through pregnancy gingivitis. So the gums are sore. You got all these hormone changes. So you don't clean her teeth as well because the gums bleed.
Mm.
So what happens then is you get more cavities because you left the plaque up on the teeth. Well, it wasn't that the baby took the calcium out; it's that the gums got inflamed. Your teeth, the gums hurt. You didn't clean your teeth as well. You end up with some cavities. Now, the good news is if you'll really keep your teeth clean, you don't get pregnancy gingivitis. But you've
Mhm.
got to keep it really, really clean, and that's again why we talk about 5 to 7 minutes one time a day. But as far as when the baby is being formed or is growing after the baby's nursing or bottle fed or whatever, they have to have the proper nutrients to form the right things on the teeth. So yes, the diet that you have at that age does make a difference, and that's why you do have calcium and things like that in breast milk. That's what it's made for, to
Mhm.
help you develop properly. So can you not give a baby the proper nutrition? Sure, the baby has no control over that.
Mhm.
So it's important for mom and dad to know, how can my baby eat right, but also how can I help keep my baby's teeth good and clean? Because when that baby's born, it does not even have the bacteria that can cause cavities. They pick that up from mom or dad or from the dog or whatever. Kissing, sharing a drink, sharing a straw, something like that.
The binky on the floor.
Yeah, there you go.
Yeah.
Yeah, let me clean it off with my mouth. And here, put it back in yours.
Right.
Gee, I wonder where the bacteria came from. So yeah, that does have a factor. So yes, you can. The teeth may not form properly, but even people with what they call soft teeth, if you keep those teeth really, really, really clean, you're fine.
All right, we're going to take a break, and I want to come right back to that soft teeth.
Okay.
Because I've heard that, and I don't know what it means. So hang on just a second.
Dr. Chuck Reinhardtson has been practicing dentistry in Central Florida since 1979, and he believes the health of your mouth is the #1 priority. If you would like to be a patient of Dr. Chuck's and you're in Central Florida, you can call him at 352-253-6400.
Okay, let's talk about soft teeth. What are soft teeth? Is
Well,
that literal? Like they're really soft?
That's a term I think a lot of people have used. Maybe dentists in the past have used it. If a tooth was not properly calcified, or if it was decalcified, where you get these white blotches on that, they used to call that soft teeth because that enamel was a little bit more susceptible to cavities than regular enamel on that. And so, oh yeah, I got soft teeth. Well, the reason you have soft teeth, generally speaking, unless it's from the diet when the teeth were forming, is because of bacteria on there, and you've begun the demineralizing process, which is the first step of cavities. Kids with orthodontics, with braces, if they didn't keep those brackets really clean every day, when they took off the brackets, you have these white blotches all over the teeth.
Yes.
So you had straight teeth, but now they were full of white blotches, and kind of hard to get rid of those. So that you could kind of look at as a type of soft tooth, because that enamel is more susceptible at becoming a cavity. But if you keep that really clean, again, you won't get a cavity. You have to have the bacteria giving off the acids to get a cavity. If you remove that every day, you're fine.
I had a friend that when their braces were taken off, that happened. I mean, it wasn't me. I'm not saying it was well, maybe it was me. Okay, we've got a question. We kind of talked a little bit about pregnancy, and Melissa went to filthymouthpodcast.com and asked a question right on the webpage. Just click if you're on your phone or if you're at your computer, you can just talk right into your microphone. And this is Melissa's question.
Hey, Dr. Chuck, this is Melissa. I'm expecting my first baby. Should I look into special care for my mouth while I'm pregnant?
Yeah. Now your obstetrician will advise you as far as any prenatal vitamins like that. But absolutely, you need to pay really attention to your mouth. When you are pregnant, your body goes through all these hormone changes, and there's something called pregnancy gingivitis, where the gums become super tender. Well, a lot of times people will tend to not clean their teeth as well because they're a little bit tender. Don't do that. Really spend that 5 to 7 minutes one time a day. Really get in there, clean the teeth really well, and the pregnancy gingivitis will be greatly reduced. So that's one of the things that you can focus on right there. The second thing is make sure you have a healthy mouth, because if you have a bunch of cavities or gum disease right now, just remember whatever bacteria you have in your mouth is going through the rest of your body, and you don't want that going to the baby. They've shown that some of the bacteria in gum disease they will help for preterm births. They trigger contractions in the uterus. There's some of them that it's called Fusobacterium nucleatum, and it's one of the bacteria in there. And there are other things that happen. So yeah, just think about that. Would you want an infection? Would you want pus running through your developing baby, or through the placenta that's feeding your developing baby? And the answer is probably no.
Yeah. Is there another myth that we have not touched on that you just totally want to burst like a balloon?
I hear a lot of different things from people coming in, and sometimes you just listen.
Yeah. You go, where did you hear that? Why? What are you talking about?
Yeah. And I can't think. I'll have to keep track
Okay.
of different things that I hear from patients. But sometimes you just sit back and smile.
Yeah.
And people will tell you all the reasons for why their teeth are bad. And again, you sit back and smile, and you listen. And some people want to learn, and other people want to defend what they've always done. And so there's a phrase that I go by, and please, I hope nobody takes offense to this, but this is never try and teach a pig to sing. It wastes your time and annoys the pig.
I think
Okay?
the only ones that will be annoyed are the pigs. that are listening to this podcast. So I think we're covered. I think we're good.
But it's amazing how some people are willing to listen and other people have all the answers. And I absolutely do not have all the answers. I mean, the more I know, the more I realize I don't know. And this is why we need to at least spread out the information that we do know. That let's have a healthcare system and not just a patch it system. You know, let's try and prevent the problems rather than treating them afterwards. Let's not treat just the symptoms. Let's get to the source. You know, that's really where we need to go on so many of these things. And if we leave the source untouched, you're going to be taking care of that for the rest of your life. When you remove the source, maybe you can get help.
Thanks for listening to Your Filthy Mouth. You can follow Dr. Chuck on Facebook, Twitter, LinkedIn, and YouTube at Your Filthy Mouth, or go to our webpage at filthymouthpodcast.com. There's a lot of fun, interactive things going on there. As a matter of fact, look for the Ask Dr. Chuck button, and you can record a question right from your computer. Or email your Filthy Mouth related photos and questions to filthymouthpodcast@gmail.com. And please be sure to rate the show on iTunes. It really helps us out a ton. And subscribe to the show so the new episodes automatically come to you. And if you're in Central Florida and you'd like to be a patient of Dr. Chuck, or you'd like him to speak to your group or organization, please call him at Lifetime Dental in Tavares, Florida, 352-253-6400.